This segment sponsored by Neighborhood Health. Neighborhood Health is a healthcare home for everyone, offering one-on-one care in a compassionate and respectful manner. Here to share more with me today is Sarah Neace, the Director of Mission Advancement. Hi, Sarah.
Hello. So great to be here.
Yes, you look beautiful. I told you,
Thank you.
that red is popping.
Hey.
I love it. So let's start off by you sharing with us about Neighborhood Health.
Yes, so Neighborhood Health has actually been around for over 50 years. So we started off in 1969 as a well baby clinic.
Wow.
And with volunteer doctors at that time and serving patients really who needed it most, mothers and children, infants. So we've been here, we've expanded along the ways, and we're just excited to share our services because I think we're kind of one of those best kept secrets, but we don't want to be a secret anymore, you know?
So that's so incredible. 50 years is amazing. And so the whole concept of healthcare home for everyone, what does that mean? What services do you offer?
Yes, I'm glad you asked. So we have primary medical. So of course, you need that preventative checkup or something, is going wrong. Of course, you call us. But then we have women's health, so some specialty services. We have dental, you need that checkup for dental or emergency care for dental. We have optometry, a wide variety of glasses, even a wide variety of Medicare, Medicaid approved glasses. And then we also have recently offered chiropractic services, which is a new line. So. And then lastly, behavioral health services. And so we know that mental health care especially, has become more prevalent after COVID. We realize we have to treat the whole person. And so every piece matters.
Every piece matters. And you cover every piece, which is great. And so, and just to clarify, is this a facility that people go in, they get the health care and the health services, or do they need to come in with their own health care to receive your services?
Yes, that's a great question. So we are actually for all payer types. And so if you have insurance, you have private insurance or public insurance, come to us, great. If you don't, we offer a sliding fee scale where it's income based. So you can actually pay as low as $5 a visit for behavioral health, as low as $20 a visit for a medical visit. And so, we're here for everybody.
Wow, that's really incredible. It really is, and so needed. And so what do you feel are some misconceptions that people have as they're trying to understand your organization more?
Yes, I think that people don't realize, first of all, the array of services that we offer. They may say, oh, something emergency comes up, let me go. Or if you don't have insurance, then you go to Neighborhood Health, And of course, please come to us if you don't have insurance. But we're really here for everyone. We also have these supportive services as well. We serve those who speak another language opposed to English. And so we have interpretation services on site as well as video interpretation services. So that's really important to us. And then I think the fact that we have multiple locations. And so we have our downtown location off Calhoun. We also have a site that's off of East Paulding Road. And then we're getting ready to open a third clinic location as well. And so just the variety of services, the variety of care, the variety of payer types, I think, and the fact that we've been here, we've been doing this, we have experts, we're, though we started off having volunteers, they are no longer volunteers, they are very well-versed paid, physicians, nurse practitioners, dentists, licensed clinical social workers, and so the quality of care is top notch.
I love that. I mean, 50 years, there's experience there, right?
Yeah.
And I love that you all have evolved and have grown and continue to add new services and working on new projects. So share with me about the Oxford Project.
Yes, so the Oxford Project, it's really our passion project. Though we serve over 50 zip codes, patients from over 50 zip codes, the highest percentage of those patients actually come from 46806. So that's the Oxford neighborhood. And so just trying to find a way to better serve not only those patients, but reach the 15,000 patients that are there that aren't being served with their healthcare needs, where they have transportation barriers sometimes and other barriers to care. And so The old former Ward School building, was going through a transition, and the neighbors actually rallied to save that building. And, they're very passionate about our services. And so it was just kind of the perfect fit. And we were able to take ownership of that building, and now we're in the process of a capital campaign where we're raising funds because, we know that transformation is not cheap, but it's worth it.
Right.
It's worth it for that community who have a lot of health disparities. Neighborhood health is all about health equity, and that means providing the right kind of services, the right kind of care for those who need it. And so you've probably heard recently in the news about the infant mortality rate in the 46806 neighborhood. And a lot of that has to do with access to care. If you don't have transportation, or it takes you 2 hours on the bus to get somewhere, where if you're in the backyard, you can just walk there and get care, it's different. And so we want to be there. We want to be there with expert care. We want to have the team surrounding that. If maybe you came in for prenatal health needs, but you have some postpartum depression, now we're here with behavioral health services to meet those needs, because it's not just one thing. It's really holistic care. So
that is awesome. Thank you so much, Sarah, for sharing that wonderful information. I know it's so valuable, and I learned a lot too.
It is. It is.
It is, yes. And neighborhood health, they are currently welcoming new patients. So if you are interested in learning more, you can check out their website, and we'll be right back. This segment sponsored by Neighborhood Health.